HIV testing is beneficial because once a person is diagnosed early and gets into care and treatment, then that person can live a healthy and longer life. A person who knows his or her HIV status can protect himself or herself and their partner, and they must practice safe sex at all times. Thank you to Scotiabank for opening up the dialogue, talking about sex, safe sex, and testing. Knowing one's HIV status allows one to make important decisions, such as planning a family. Someone who is HIV positive can have a negative child, protecting a baby that is developing in a mother, and making plans for the future. Knowing one's HIV status empowers that person to ask important questions, as Mr. Julian Rogers said. What is the difference between HIV and AIDS? How did I get HIV? Can I be cured? What happens now I have HIV? What are the symptoms of HIV? The questions go on and on. What is that CD4 count? What does it mean? What is the viral load? What does it mean? How long do I need to take the HIV medication? Do I need to use condoms? Will I die? Will I die? A person who knows his or her HIV status can share the information with the doctor, and the doctor will be better able to treat that individual. Worldwide, it is estimated that there are still about 33 million people who are living with HIV. In Antigua and Barbuda, since testing began, over 1,000 persons have been confirmed positive until the end of April 2014. Of that number, 245 have already died, and about 248 are in the care and treatment program. So that means that there are about 500 to 700 persons who know their status to be positive and are not in care and treatment. So these confirmed cases only represent a portion of the true numbers. There are about another 25% of persons who are HIV positive and do not know their status. A positive diagnosis for HIV, as was mentioned, carries challenges in a relatively small country as Antigua and Barbuda. Affected persons still face stigma and discrimination. Even though that has decreased, they still face it every single day. And it drives these persons not to attend the care and treatment centers. Now, testing for HIV in Antigua and Barbuda at the National AIDS Secretariat utilizes what is called rapid testing. The rapid testing results are available within 15 to 20 minutes. The rapid testing utilizes 2 different kits simultaneously to test a pinprick amount of blood from the person. Now, if a test comes back positive, the test has to be repeated for a definitive diagnosis to be made. Another way of testing for HIV is doing the standard blood tests to check for the virus and the antibodies. These tests take a little longer, about 1 to 2 weeks to get the results, but these can be done at Mount St. John. In other developed countries, such as the United States, they can use oral fluids instead of blood, and these fluids are evaluated using the EIA methods. Now, a person who has been diagnosed with HIV and needs to start treatment is provided with all their medications and necessary lab investigations at the clinical care coordinator's clinic at no cost. The HIV medication consists of a combination of 3 different medications. The medications are called antiretroviral drugs and are divided into 5 drug classes. Now, these drug classes are divided into groups called entry inhibitors. These are the drugs that prevent the virus from getting into the cells. Integrase inhibitors, nucleoside reverse transcriptase inhibitors, non-nucleoside reverse transcriptase inhibitors, and protein inhibitors. I know these terms are a little difficult, but these are the drugs categories that are used. And we are very fortunate in Antigua that we can be provided with this medication. Initially, Global Fund provided all the medication, but after a while, they have now said, look, you guys, you have to start paying for your medication. So now we have to have medical benefits coming on board to start paying about 35% of the cost for these medications. The thing is, a person who is HIV positive and takes the medication can live a healthy, long life. They get the viral load down, and they get the CD4 count up. Now, in circumstances, I must tell you, there are certain cases where a person may have become exposed to the HIV virus through a needle stick, incorrect use of condoms, and even an assault. And in those cases, they also need to get the antiretroviral medication to prevent contracting the virus. In these cases, the person is given what is called post-exposure prophylaxis, or PEP, to prevent infection. The medications also consist of a combination of drugs and are available at Mount St. John Medical Center. In fact, the Center for Disease Control, or CDC, in the United States recommends that HIV testing be a routine part of everyone's physical examination. So the young lady going for a pap smear or mammogram, she should have the HIV testing. Testing is especially important in all pregnant women to prevent the transmission of the virus to the baby. And I'm pleased to say, in Antigua, all the babies that we've had so far have been negative due to the hard work, especially of the Secretariat. Now, the CDC also recommends that a person can start getting the HIV testing from 13 years of age, because they have found that children are becoming more sexually active earlier, so they can start getting the testing from 13 years of age, and at the Secretariat, a person can walk into the Secretariat, and a teenager, and can request that test, and they're given the test, which is quite helpful. A number of persons also are recommended to have the test done quite regularly. Persons who have a sexually transmitted disease, persons who have many sexual partners, people who have been diagnosed with tuberculosis, all of these groups are encouraged to do the HIV test. Now, for Antigua and Barbuda, the strategic plans for HIV involves optimizing HIV prevention, diagnosis, treatment, and care. The plans will focus on the elimination of any new HIV infection in children. The health sector will build strong and sustainable systems by strengthening the links between HIV and other health programs, as was mentioned, and reduce the vulnerability. Structural barriers to accessing services will be removed. So no longer will I have to hear my compatriot who speaks Spanish coming to me and saying, when I go to the clinic, they ask me for my passport. Those barriers are to be removed. Anyone can access the service. At-risk groups such as MSN, commercial sex workers, transgender individuals, and migrants will be focused on. Stigma and discrimination issues will be addressed and can be decreased with knowledge and education.